Hello friends, I am Dr. Rohini Ruhil. Today we will try to understand rural health in India. The 2011 census tells us that rural India is home to about 833 million people. That's almost 69% of whole country's population. This really shows us that India is mainly a rural country with most of its people living in villages. Now, there are unique challenges faced by rural populations, and that's why it is important to study rural health in India. Now, first of all, how we will define the term rural? In some countries, a rural area is defined on the basis of size and density of population. But in India, it is defined in terms of revenue village. The term revenue village refers to the smallest unit of administration that has defined boundaries and is recognized for legal and administrative purposes related to land revenue collection. Now, unlike informal definitions of village based on social or cultural criteria, a revenue village has specific and defined geographical boundaries. And the primary purpose of identifying and defining revenue village is to facilitate the collection of land revenue or taxes from the occupants or landowners. This revenue villages, these often serve as the basis for organizing local governance units such as panchayats. Now, rural populations in India face significant health challenges. These challenges arise from a complex interplay of socio-economic, cultural and structural determinants. Rural populations are disproportionately impacted by infectious diseases, malnutrition, maternal and child health complications, as well as a rising prevalence of non-communicable diseases such as diabetes and hypertension. Rural areas often have limited access to healthcare facilities, limited access to hospitals, clinics, trained healthcare professionals. And above all, rural Indians face poverty, illiteracy, lack of access to sanitation, infrastructure. They also face food insecurity. So, all this affects social determinants of health and thus their health. Now, coming to health issues and health seeking behavior in rural India. Rural population face a high burden of infectious diseases such as tuberculosis, malaria, various waterborne illnesses like cholera, typhoid fever, respiratory infections including pneumonia. These are also widespread, and these are partly due to poor air quality and indoor air pollution from the use of biomass fuels. And there is also a rising incidence of chronic diseases, especially these days due to current changes in the lifestyles, the chronic diseases like diabetes, hypertension, cardiovascular diseases. And they also have limited access to preventive health care. Then, coming to health seeking behavior, rural populations in India frequently resort to informal healthcare providers who lack valid medical qualifications, and this is for various reasons, including accessibility to informal healthcare providers, their cost effectiveness, and familiarity with them, trust on them. And this depicts a scenario where informal healthcare providers play a crucial role in the healthcare landscape of rural India. And they serve as first point of contact. Then, regarding the valid healthcare providers, the research has indicated that rural populations have clear preference for private healthcare over public healthcare, and especially for the institutional deliveries. This preference is driven by various considerations such as proximity to residence, and also most importantly, the perceived decline, the recent decline in the quality and increase in the waiting times at public health facilities. let's look at the healthcare infrastructure in rural India. We all know that India has a three-tier healthcare infrastructure: primary, secondary, tertiary. And this three-tier healthcare infrastructure, it particularly focus on bridging the gap between urban and rural healthcare services. The system consists of primary, secondary, and tertiary healthcare facilities. Now, at the grassroots level, we have primary healthcare infrastructure, including sub-centers, primary health centers, community health centers, and now with Ayushman Bharat, these are being converted into health and wellness centers. These centers are predominantly aimed at serving the rural and remote populations. They provide basic healthcare services like infant immunization programs, maternal care. They are the first point of contact between community and healthcare system. Now, the healthcare infrastructure in rural India face significant challenges. For instance, access to healthcare, like research has shown, which is mentioned here, that in empowered action group states, EAG states, so the access is significantly impeded by poor quality, long waiting times in public health facilities. Then during this COVID-19, the research has shown that COVID-19 pandemic exacerbated the existing disparities in healthcare access in rural areas. Then in April 2005, National Rural Health Mission NRHM was launched by Government of India. Its aim was to provide accessible, affordable and quality healthcare services to rural populations, especially the vulnerable group. Now, the mission sought to improve the availability and access to quality healthcare by increasing public health spending, strengthening rural health infrastructure, and enhancing the capacity of health workers. Then in 2013, this NRHM was subsumed under the broader National Health Mission NHM, and this NHM also includes its other subcomponent, which is National Urban Health Mission. Now, Asha, accredited social health activist. These workers are critical part of NRHM to provide effective healthcare to rural populations. Asha women are the local women. They are trained to act as health educators and also the promoters in their communities. They work as a bridge between the healthcare system and the community. Their roles include creating awareness of health and its social determinants, then mobilizing the community towards healthcare planning, healthcare services, increasing the utilization of health services, and they are tasked with various responsibilities such as promoting universal immunization, encouraging family planning, providing information on nutrition, sanitation, other social determinants of health, then facilitating access to healthcare services. This is most important. And then also participating in various national health campaigns. And they play a crucial role in maternal and child health. They ensure that women receive proper antenatal and postnatal care. So these women play very important role. Then in 2018, Ayushman Bharat, also known as Pradhan Mantri Jan Arogya Yojana PMJY, it was launched as a flagship scheme of Indian government. The program has two main components: health and wellness centers and the National Health Protection Scheme. It aimed at providing health insurance coverage to over 10 crore 100 million families, and it covers approximately 500 million individuals, and it is a part of a broader initiative towards achieving universal health coverage. And this scheme offers a health cover of rupees 5 lakhs per family per year for secondary and tertiary care, hospitalization across public and private empaneled hospitals in India. Then Ayushman Bharat Digital Mission ABDM, it was launched in 2021 as an extension of the Ayushman Bharat scheme. Under this Ayushman Bharat digital mission, unique digital health ID is generated for every individual, which securely stores and manages their health records across various healthcare providers. And it also promotes the use of digital technology for healthcare delivery. Now, some community based healthcare projects have been very successful in shaping rural healthcare. One such initiative was Comprehensive Rural Health Project CRHP in Jamkhed, Maharashtra. One of the cornerstone principle of CRHP was involving the community at every level of healthcare intervention process. This approach of involving the community ensures that the programs are culturally appropriate and widely accepted by community members. Then, under this, women from the villages were trained as village health workers to provide wide range of healthcare services, including maternal and child health, family planning, nutrition, education, sanitation, prevention and treatment of common diseases, just like Asha under NRHM. Then CRHP adopted a holistic approach to health. It addressed not just the medical needs but also worked on the social determinants of health, such as nutrition, sanitation, education. So, this approach of involving the social determinants of health, and it included various initiatives like kitchen gardens, water conservation projects, vocational training for women, youth, involvement of youth in the project. And this project was very successful in shaping the rural healthcare. And by focusing on prevention and leveraging the community resources and training local healthcare providers, this comprehensive rural health project, it minimizes the need for expensive hospital care. So it was a low cost project. Now, coming to some future directions for improving rural health in India. So, future directions, most importantly, it includes strengthening the public healthcare infrastructure. That our public healthcare infrastructure should be strengthened, especially in rural areas. It should be equipped with modern medical technology, and the transportation should be reliable. The emergency transportation, the emergency care, routine care, that should be reliable. The supply chains, we should have stable supply chains for essential medicines, for vaccines. Then infrastructure development also ensures utilities like electricity, clean water, and these are indispensable for healthcare facilities. Then women and children in rural areas, they face particular health challenges. They need to be addressed, especially the special attention is required to women and children. Now integration with traditional medicine, and that is being done also, like we have Ayush ministry separately, and it has been discussed in a separate video, so on medical pluralism, so you can watch that video. That integration with traditional medicine, that is very important, especially in the rural areas, because it is widely practiced in the communities. Then community participation is the key to transforming rural health, empowering communities through health education, preventive measures. So, integration of these measures can lead to a more equitable and efficient healthcare system in rural areas. Now, to conclude, at last, I would like to say that together we can pave the way for a healthier rural India where every individual has the right to quality healthcare. So, with this, I end my presentation. Thank you very much for listening. Please like and subscribe to the channel. See you again. Thank you.